Are you sad? I mean, S.A.D. Seasonal Affective Disorder.
Hello, everyone. I am Dr. Roni MD, and welcome to Quick Tip Tuesdays. So, do you have some sad? I don't mean like tears. I'm talking like S.A.D. You might be wondering, what is S.A.D? S.A.D is seasonal affective disorder. It is a type of depression that typically hits in the fall and lasts through the winter months. Now, if you're in sunny California or Florida, you might not experience S.A.D that much. But those of us hailing from the Midwest and the Northeast, we can experience it quite often because we can easily go 6 months without sunlight. Ugh, goodness. Anyway, what is S.A.D? I'm going to go into a little bit more detail about what it is, and what you can do about it if you are experiencing it. So, S.A.D, again, is seasonal affective disorder. It is a type of depression that hits this cold, wintry time of year. Now, if you are experiencing some of the following symptoms, you might have it. So that includes feeling depressed most of the day, almost every day. You might have a loss of interest. Now, don't get that confused with you just aren't interested in a particular thing. Like, I don't want to go to school today, or I don't want to go to work today. No, that's different. This is, you don't want to play your video games, or you don't enjoy cooking anymore, or you don't want to watch your favorite television show. And this goes on for days and days. Yeah, that's what I mean. The other is you might have a loss of energy. I'm talking like you just feel drained. You haven't done anything particularly different with your daily routine, but you just feel exhausted. It happens. You could have problems sleeping. So that could be you having a hard time getting to sleep, you wake up throughout the night, or you wake up super early, or typically with S.A.D, you're oversleeping. Now, some of us might say, hey, I like my bed and it's cold out there and I just want to snuggle up. But if you're just like laying down, you want to sleep all the time, you don't want to get up, it might be S.A.D. You could have a change in your appetite or even in your weight. Um, and it can happen. You might not have an appetite at all, or you're even overeating. Now with S.A.D, you could be craving those carbs. Now, I mean, some carbs are like really fun, like sweet potato pie and macaroni and cheese, things like that. But I mean, if you're just like you know going ham on all of the Thanksgiving sweets and the Christmas sweets, and it's nowhere near Thanksgiving or Christmas, maybe you could have difficulty concentrating. So maybe you are having a hard time remember what 2 plus 2 is. It's okay. It happens to the best of us. Now, you could also be having feelings of hopelessness, worthlessness, and guilt, um, which can be a little bit more concerning. Also, you might have thoughts of suicide or death. And if you are having those thoughts, please reach out to a medical professional ASAP. Okay? There are hotlines that you can call. You can call 911. You can go to urgent care or ER, or call your doctor. But definitely reach out to a medical professional if you are having thoughts of suicide or death. Okay? Now, you might be wondering, well, what can I do if I'm feeling sad? If I'm feeling S.A.D? Um, Light therapy is something that you can do if you're waiting to get into with the doctor and you're just like, I need to do something now, right? But you're not so far gone as like feelings of suicide or death. A light box. Order one online. These are some powerful lights. Okay, I personally have not gotten a light box myself, but I've had some friends who've told me that's pretty bright. First thing in the morning, pop that puppy on. It's 10,000 lux. Now, I don't know what lux is. That wasn't my major in college or med school, but I can imagine that's pretty bright. Okay, especially first thing in the morning when your eyes are just not ready. Okay, I wasn't ready. All right. But you want to do that for 30 to 45 minutes. Okay. The other thing that you can do is get some vitamin D. So some good old fashioned over the counter vitamin D is fine. Um, or get the natural stuff. Go outside. All right. So try to get out there sometime between 10 in the morning and noon. Now you might be saying, I haven't seen the sun in a week because, Chicago is like that. It don't want to show me the sun. Okay. And I get that. But going outside, even if it is a cloudy day, there's still some like minimal level of exposure you can get. Even if you don't see the sun, you can get some sun. Okay. Not to mention it's good to get some fresh air because you don't want to be stuck with that cabin air. I mean, we've already got COVID air. I don't mean like necessarily sick air, but I just mean like you've been stuck in the house since March and you haven't cracked a window. Please do that. Um, but getting some fresh air. So bundle up, go outside, walk for about 30, 45 minutes, get some sunlight, get some fresh air, and check this out, you're getting some exercise too. So that's another thing that can definitely help is getting some exercise. So I know, I know you have been wearing your yoga pants all quarantine. Don't lie. Okay. I currently have on leggings right now. Okay. Um, but put them to good use. Okay. So you got those yoga pants, you got the leggings, you got the stretch pants, um, sweatpants, whatever, doesn't matter. Okay. Pull out the yoga mat, get to do some yoga. Okay. Do some meditations. Um, Connect with some online classes. Get up there, do a Zumba. Okay. A Zumba. A Zumba. All right. Do some cardio, some HIIT classes. Do something to get you moving. Okay. Because the exercise does help. Getting that blood flowing. Moving about the exercise is good in general for just feeling down, and especially with S.A.D. Now, if you feel like you definitely need to reach out to your doctor, which might be a good thing to do, um, they can actually prescribe different medications that might help because you might be dealing with a more severe level of S.A.D. Um, or you might actually have major depressive disorder, which is kind of more throughout the year than just this time of year. So yeah, there are some different medications that you may be prescribed, which may help. There's also talk therapy or cognitive behavioral therapy, which is good because some people just need to talk. You know, Medication is good, but not everybody needs it. And a good talk therapy or cognitive behavioral therapy with a therapist can really kind of, break you out of S.A.D. Okay? So, the other thing, with us being in the COVID right now, talking to people, period. Okay? So, Zoom, FaceTime, Duo, video chat, Google Chat, whatever is out there. I know there's 50 million video chatting apps. Talk to somebody. Vent to your best girlfriend. You know, chat it up and talk with your boys. Do what you got to do to stay social, because the other thing with S.A.D is people often socially retreat. So you don't want to do that, okay? Um, so yeah, oh, and there's also music or art therapy, got a couple of coloring books. Crazy little coloring book I got here. Um, or pull out the watercolors. I mean, run to the dollar store, go get you some, one of those little watercolors that you typically would get for kids, and some brushes, and just paint. It doesn't even have to be a Monet or a Renoir or Picasso. It could be a Picasso or a Ucasso, whatever. Okay, but it's very important that you try to take care of yourself as far as your emotional and psychological health, not just um, for the winter time, but also this year because we've got winter time coinciding with COVID time. And so, depression is real. Um, it's something that, people have dealt with. I've dealt with it. I'm just being very transparent here. I've dealt with it, not just seasonal, but throughout the year. And it's something that is also often not talked about in the Black community. Shake it off, pray on it, go to church. And there's nothing wrong with that. In fact, I say do that and talk to a doctor. Put them together, you know. Um, but yeah, so hopefully I've been able to give you guys a little bit of insight on what you might be feeling this year. Because maybe, things were going on in previous years, you weren't paying attention to it because, we had the opportunity to meet with family and hang out with friends. But this year, everything is falling on top of everybody because of the COVID. And it's real. So, again, today I'm talking to you guys. I've talked to you guys today about S.A.D, or seasonal affective disorder, which is a type of depression. And at the end of this, I will include some information on some hotlines to call in case you are feeling suicidal or having thoughts of death, because I want to give you guys some resources to make sure that you are doing okay. And again, there's always, in the case of you just really need to go somewhere, call 911 or go to the ER. And I understand it's a lot going on to go into a hospital during this time, but we want to make sure that you're not just physically safe, but you're also mentally safe. Okay? So, I am Dr. Roni, and I'm being paged to take care of you. Talk to you next time. Oh, by the way, remember to like, subscribe, and share these videos with your friends and family. Talk to you next time.